Today is December 16. This Yorkshire Terrier male, neutered, 9 years old. The complaint is grinding sound, right?
Yeah.
And actually the main clue is the rubbing of the left face, which the owner didn't tell me until later. Now actually you can see, we can hold that, just see the wound. Actually,
It's okay.
put it down a bit so that I don't.
It's okay.
Okay, I won't touch you, okay? If it doesn't move first. No,
Wait.
I just need the wound. Then that is the clue of carnassial tooth abscess. Of course, the rubbing for 2 weeks. Now let's see. Wait, if you can doesn't turn his head. If you can just sort of stop his head turning. Okay, I know. We don't touch his mouth. And then the other clue is there's not a lot of people that open his mouth. Wait, can I do it? No, because it's kind of a bit closer, a bit this way, so that my angle is. I just want to focus on that. Okay, never mind. So these are the clues. Rubbing of the left side of the face, a small wound there, which is below the eyelid, and of course, the sound. There's some sound, the grinding or creaking of the sound as he tries to relieve his pain. I guess, yeah. It's quite painful because the pus goes into the sinus, maxillary sinus, just below the root. The complaint is that the dog has been rubbing the left lower eye for 2 weeks, and then has this sound like grinding, like that, teeth grinding sound, and that part of the lower eye was hairless. This part, yeah. This one was hairless, but it's a small wound there. So we suspect it was any abscess or not? No abscess. So we do the dental first. The other side also the same. Tartar, yeah. This dog is quite old, 9 years old. Haven't done dentistry before, yeah. Okay, so turn over again. Turn over, so that I can video the other side. Okay. The dental, yeah. There. It's quite solid tartar for 9 years of tartar, yeah. Okay. Dental. What time is it? 12:49. 1%. Oxygen. It looks quite solid. That's good. No exposed roots. I was rubbing the eyes early on. The complaint is grinding sounds. Lots of tartar. good teeth, no loose teeth. Unlikely to have molar abscess. The grinding sound, there was a complaint of grinding sound or chattering or could check any ulcer. No ulcer. One and a half %, solid.
Yeah, it's not moving.
The one in front, PM3, M1. M1 is the one behind. Nothing, huh? So it could be conjunctivitis, the rubbing of the eyes. Don't have exposed roots as well. Looks quite good, yeah. Today is December 16/2016, Thursday. Now, this beautiful Yorkshire Terrier, male, neutered, 9 years old, had dental scaling under Domitor plus ketamine, IV, and then isoflurane gas. So after the dental scaling, I gave the antidote. It's called antecedent, so that the dog can wake up. So I give antecedent 0.01 IM, and now you can see within 1 minute the dog is awake. So that when the dog is awake, it's unlikely to die from respiratory depression, and of course that's the reason for using antidote, although you can wait for the dog to wake up by himself over time. Now the Domitor was 0.05, so roughly the vet can give 0.05 or 0.1 ml the antidote, antecedent IM. And to me, I would believe in getting the dog to wake up rather than just to sleep until the sedation wears off, and then they wake up by themselves. Now the dog is still under drip. Now you can see his teeth has been already scaled nicely, clean, and he's got good solid teeth. I'm surprised for 9-year-old. The owner must have fed him very well, and he goes for grooming every month. I don't think the groomer is supposed to clean his teeth, but as you can see, they are full of tartar. So the groomer really didn't do it. Although, as you can see, the dog won't allow anybody to open his mouth. You see, he doesn't allow. But now, of course, it's a bit sedated. Now the left side. There's difficulty opening the left side, so there will be some pain. Now, there was the eye rubbing, conjunctivitis. So, the complaint of tongue in, coming out could be due to the dog having a nasal discharge from an upper respiratory tract infection. And of course, the sound, there's some unexplained sounds of, they call it teeth. It's not chattering, it's teeth creaking. So there could be upper respiratory tract infection as well. And of course the dog keeps rubbing on the left side. So we can't see the malar tooth abscess, although it may be just beginning, so there's nothing to be seen. So we have to wait for the antibiotics to take effect, and if the owner does not complain anymore, then this dog should go back to normal activity with no sounds. Some sounds are really mysterious. It could be the loose joint of the jaw, temporal, mandibular joint. But nobody really knows because I don't hear the sound when the dog is here at the clinic. So sometimes you can hear, but in this case I didn't hear any sound. So it's a mystery unless the owner videotape the sound. Nowadays the young owners, they are very good in social media, so they have smartphones. But in this case the owner did surf the net and comes to Toa Payoh Vets since she saw a similar case of malar tooth abscess with the wound below the left eyelid. And in this case, essentially, this dog has it, but it's not obvious. There's a wound there, you can see it. It's a sort of black pigment below the lower eyelid. Do you see the black pigment? It's sort of there's a black pigment there. It could be due to rubbing. The pain is there. So we'll wait and see. Now the dog is awake already. So it's good because we don't want the dog to be sleeping long time and then maybe just pass away. This is an old dog, 9 years old, much loved by the owner. Toa Payoh Vets, the case of the teeth sounds, oral sounds in a 9-year-old male neutered Yorkshire who rubs his eye for the last 2 to 3 weeks, the left eye. And this sound, it's hard to explain. It's not chattering, it's not teeth grinding, but now you can see that the dog actually has this sound. It could be this reaction. It's probably that's what the owner said, the tongue going in and out. It could be the sound because then after it stops. See? But there's no mouth ulcers or anything inside the mouth. Yeah. Well, this is a rare thing, but I did just observe or video what the owner was trying to explain to me. This is probably what she's trying to explain to me. This behavior of the dog, tongue in and out. There, a bit of salivation, but it's hard to say because this dog now is recovering from anesthesia, so this reaction might be due to anesthetic waking up. Yeah. Where now the dog really can stand up, and I may have to stop the drip now once he's awake. Yeah. A Hartmann solution. Hartmann, and should be much better. There's good news that the dog is standing up. Yeah. So I was wondering whether that tongue in and out reaction we saw just now was what the owner meant for the last 2 to 3 weeks.